I want to talk about fixing broken front teeth. So one of the things we do quite often here is repair people's broken front teeth immediately. So if you break off your front tooth or any of your upper teeth or even bottom front tooth, it truly is an emergency. And we have a special protocol here that is relatively unique to our office, that we can take your broken off tooth out, put a dental implant in, and you leave that day with a nice solid fixed tooth screwed onto your implant. That's a beautiful tooth. And we do this many times a week. We're set up for it. We actually have a lab technician who's one of the best in the country that makes awesome teeth. We've put all the equipment into place to do this, basically because I have a large dental implant practice. So the way this works is your journey will be, you're going to come in one day bummed out because you broke off your front tooth, you can't smile, and I'm like, okay. And so we'll examine you, pick a shade, we take a CT scan to look at your bone, and evaluate it for the size of the implant and so forth. And for most patients, we sedate you or put you to sleep. It's a really easy process. We remove the broken tooth, put a dental implant in, and then once that's in place, you actually enter the world of digital dentistry, which has made this a really awesome process for people. Our lab technician comes in and we actually put a scan body on the implant. We scan your implant's position with a digital scanner, which also records the position of your other teeth and verifies a shade for the new tooth. That data is sent to our dental lab, and your tooth is then designed on the computer to match your other teeth. And then the new tooth is sent to a mill, and we actually have one of the best mills in the world, the Zirconzon M4 mill, which makes some of the most beautiful teeth. It's made in Italy, and it's makes awesome teeth. And so that tooth is milled. This takes about 30 minutes to mill it. And then once that comes out of the mill, there's a titanium base that's put in the base of it that allows us to screw your tooth right onto your implant. So from about 90 minutes, when I finish your procedure, you're sitting in the chair and we literally screw this new tooth onto the implant, and it's solid. And you leave with your new front tooth, and a lot of patients are like in tears because they can't believe we did it so quick. And probably half the time it looks better than the original teeth, and it typically looks just as good as your tooth you came in. We usually don't make an incision, don't disturb the gums, so it can be a beautiful tooth. It's pretty rewarding for us. The only caveat about this is a temporary tooth. The implants need about 4 to 5 months to fully fuse to your bone. So the threads hold this tooth in, and this tooth is made out of a temporary material called PMMA. It's a beautiful material. Your tooth is gorgeous, actually, but with time, after 4 to 5, 6 months, it has a little wear and tear on it. And because the implant's not fully fused to your bone, we make it about 1 millimeter shorter, so when you bite, it doesn't take the full bite force. Most people don't notice the aesthetic difference in that, but it just protects your tooth. And so after 4 months you come in, we verify it's fused to your bone, which like most of the time 99% or so it is. And then we send you to your dentist, who then is going to convert it to a tooth that's made out of a ceramic or porcelain that screws in, and it'll be one of the most solid teeth in your mouth. If you're eating carrots, apples, it's the tooth to use, and it'll give you long-lasting beauty, and it'll be like you never lost your tooth. So, pretty cool process. We do a lot of it.